You're watching Daytime with Kimberly and Esteban. I'm Carla Salinas, and when it comes to your ear, nose, and throat, it's important that you make the right decision. And today, we'll be speaking to Dr. Turner Wright all about what procedures can be done right here in his office. Dr. Wright is a board-certified surgeon in head and neck surgery, and he is truly the sinus expert. Today, he told us all about some of the newest procedures for patients with a nasal obstruction, a runny nose, and so much more right here in his office, all done under local anesthesia.
We've been doing nasal sinuplasty balloon surgeries for, good God, 7-8 years. You use a small balloon guided by a computer that opens the openings to each one of the sinuses, so those openings don't shut and cause pressure, pain. When people talk about, oh, I have sinus pain, what they're saying is, the opening from this sinus into my nasal cavity over the years has gotten smaller till it occluded, now building up pressure. So the balloon just goes in and reopens the opening.
And for people who have problems breathing through their nose,
we can do a very simple procedure called a turbinate reduction. You can use a system called ablation, where again, the patients come in the office, this procedure's done here. They're done wide awake, talking to me, unfortunately listening to my dumb stories. And I basically use a small ablation needle and I destroy the terminated tissue from the inside. It literally takes minutes to do. These are people that, they say, oh, when I lay on my right side, I can't breathe on my right side. When I lay on the left side, I can't breathe on my left side.
If you've ever been at dinner and your nose is running the whole time, you might just be a candidate for one of Dr. Wright's procedures.
Another new thing we're doing is people with runny nose. We call it Non-Allergic Rhinitis, which just means runny nose not associated with allergies. But there's a procedure been out for about 2 or 3 years where I can go in, again, in the clinic under topical anesthesia using the numbing jelly. I can go in and freeze a nerve in the back of the nose, and that'll greatly improve that.
And Dr. Wright's very latest procedure.
Sometimes when you're flying on an airplane, and especially when the plane's coming down, your ear fills up with pressure and you can't hear. Well, for those people, the middle ear opens into the back of the nasal cavity through the eustachian tube. And what happens when you come down the airplane, if that eustachian tube doesn't open, allow the air pressure to equilibrate from the nose to the middle ear, you build pressure, and then all of a sudden you land and you pop your jaw, hey, I can hear again. Well, another simple, easy procedure using the balloon. Under topical anesthesia here in the clinic, I can go in and place that balloon up the eustachian tube and dilate it and relieve those people.
So make the right choice today. Schedule your appointment with Dr. Wright at 956-998-6673 or visit wrightsinuschoice.com. You're watching Daytime with Kimberly and Esteban. I'm Carla Salinas, and today we'll be speaking to Dr. Turner Wright all about his balloon sinuplasty technique. And the best part, it only takes 15 minutes. Dr. Wright is a board-certified surgeon in head and neck surgery who tells us this revolutionary in-office procedure opens blocked sinus passageways without the removal of nasal bone or tissue and provides long-term relief for chronic sinusitis.
You basically have 6 big sinuses. You have 2 frontals, left and right, 2 maxillaries under the eyes, and in the back, if you connect the 2 dots, you have 2 sphenoid sinuses in the back. And people go, I don't have a problem with that. Well, a lot of times when the sphenoids bother you, the pain will be referred to the back of the head or the side of the head. Basically what happens is each one of these 6 sinuses has an opening into the nasal cavity. And the analogy I tell people, it's kind of like a hallway in a clinic, and then you have 6 rooms on the side. And imagine if you had a hole, but in each room into that hole, and so you can stick your arm through each one of those things. Now, all sinus surgery is over time, those holes can get smaller and smaller to the point where they occlude periodically. They may stop up for a day, a week, and then reopen for a month. But the holes basically have become so small that any type of inflammation, they occlude. So once they occlude, the patients build up pressure. And like we were talking about earlier, pressure is pain.
Dr. Wright tells us procedures like these have come a long way throughout the years, and now the balloon sinuplasty provides patients with a safe procedure with accurate results and fast recovery.
Now, the balloon basically goes into the opening. You inflate the balloon, and that opens the opening in an atraumatic way, and that's why we're able to do them here in the clinic. Patients tolerate them very, very well.
This procedure will have you breathing right, so make the right choice today.
And so basically, the goals after a nasal sinuplasty are to relieve patients from getting the severe pressure pain, which could be in the back of the head, or we mentioned. The other part of the procedure is reduction of turbinates, where I go in and I basically use a coblation needle to reduce the diameter and shrink the turbinates. The goal of that is to make you breathe better so you don't get stopped up. So you're looking at a procedure that takes minutes. You don't have to take a day off. You don't have to pay the hospital. You don't have to pay anesthesia. You don't have to be exposed to a lot of people having your surgery done in the clinic. And the goals of the surgery are to relieve sinus pain, pressure, infection, nasal obstruction. So the success rate is very, very high. I mean, it's very high. And the surgery is very minimally invasive.
Schedule your appointment with Dr. Wright at 956-998-6673 or visit wrightsinuschoice.com.